Hey guys, it's Kate here at the AAFE. Come along today. We are filling a patient's lips. This patient came in today and she kind of just explained to me that she'd like more volume throughout her lips. As you can see, she has a small top lip and a small bottom lip. So we are just kind of going through her lips throughout, giving her more volume and kind of just giving her more show on her top lip. She wasn't a very good candidate for a lip flip. She didn't have a gummy smile, but she did just want more show on her top lip. So that's kind of what we're doing today and kind of using this technique to achieve that goal. This was the first time the patient has ever had her lips filled, so it was really nice to kind of fill on a clean slate. I did give my patient a lot of patient education to kind of take in before she got her lips done. Obviously, I went over any complications that she could be at risk for with filler. I kind of explained to her the tolerance that she should have for pain. As you can see, she's kind of wincing throughout the video. She was cleaned and numbed prior to injecting, but the lips are a pinchy area, so it's always important to kind of educate your patient on the expectations that they should have. I also educated this patient about having realistic expectations of what the outcome of her lips were going to be like. Obviously, she wanted more volume throughout, but I definitely wanted to make sure she knew that she wasn't going to get huge lips in the first appointment. Personally, what I like to do is do one appointment and then have the patient come back in 2 weeks and kind of give them a little more of an enhancement if they need it. This kind of gives your lips a break and allows them to kind of just take to the filler, especially if the patient has never had filler before. It can be very overwhelming to get your lips done for the first time and automatically think that they're way too big. So today I use the 90-degree angle technique with some standard volumization. So as you can see, the 90-degree angle is going into that vermilion border, in the pink of that vermilion border, not on the outside, kind of finding the desired location of where I want that filler and then pushing the product slowly and retrograding. As you can see, I do this throughout her whole top lip. What this does is it kind of gives you more of a top lip show and kind of allows that top lip to be more pronounced. If you're starting with a smaller top lip, this is a great technique to use just to kind of give more show of the lip in order for you to go back in and add more volume using standard volume technique. So I use these two techniques hand in hand. First, I did 90-degree angle to get me the desired show. And then I went in, as you can see right now, I'm using standard volume technique and kind of just giving her a little fill wherever I think she has deficit. The way I assess a patient to see if they have any deficits is to have them sit straight up and kind of just look at their lips and look for asymmetries and what side has more volume than the other. What I do here is I always start on the side that has more of a deficit because it's typically the side that's going to use more fillers. So you kind of just want to be aware of that as you go. So here I am on the other side of the lip, kind of just using that same standardized volume technique that I use on the opposite side. As you can see, I'm using a little bit of a fanning method. So that means I'm inserting through one hole, retrograding product, readjusting my needle, retrograding product. I'm using one hole so it's less pokes for the patient and it allows you to get more filler in one area of the lip. I'm using that same fanning technique on the bottom lip too, right in the pillows of the lips to kind of give her more of a pouty look on the bottom. So here, once again on the other side, I'm kind of assessing the patient's lip. I'm looking at the top lip here to see where that natural peak in that cupid's bow is, and that's where I'm filling on the bottom lip. The pouty look in the pillows of the lips on the bottom lip should be in line with that natural cupid's bow. So I'm kind of just going in and adding extra volume there because that's the natural appearance of a lip, and I'm kind of just trying to enhance that. Here I am on the bottom of the lip using standard volume technique. I'm kind of just going around the edges to kind of create a more defined border. As you can see, I'm just working my way along the bottom. I already filled the pillows of the lips, and this is kind of just giving a more defined look to her bottom lip. Standardized volumization is also great for removing those little fine lines and wrinkles on the lips. Those little wrinkles typically mean that the lip is dehydrated, and adding a little filler in these locations can just give it a more hydrated, plump look. So if I do see those wrinkles, I kind of go after them a little bit just to kind of hydrate those lips and give a nice smooth appearance. Something that I do in my practice is I massage throughout the whole procedure. So as you can see, I'm using backfilled syringes. So after I'm done using one of these backfilled syringes, I massage between each one of them. I kind of just do this to kind of massage any lumps and bumps in the filler and kind of make sure that the lips are looking smooth, and so I can actually assess which side needs more volume compared to the other. After I assessed the patient, I kind of decided that I wanted to go back into the pillows of the bottom lip and kind of give her more volume. After I assessed the top lip, I noticed that she needed a little more peak in her cupid's bow, so that's what I'm doing here. I'm kind of going at a diagonal angle through that cupid's bow, retrograding product on my way out. It's kind of just picking up that natural cupid bow and kind of enhancing the natural shape of it. When I do these appointments, I never do a full syringe in one appointment, especially if it's the patient's first time getting their lips done, just because I don't want them to be overwhelmed with the results. You can always go back in and put more filler, but you can't really take it out unless you fully dissolve the patient. So as you can see here, I'm kind of just massaging the patient like I previously talked about, kind of just seeing if she's having any pain, massaging out those bumps and lumps in the filler, and kind of what's assessing what is a bruise and swelling so I don't chase it when I'm injecting. When the patient bruises or swelling, it's very easy to see asymmetry and want to balance it out on the other side. But you don't want to ever chase bruising or swelling because that's how you're going to end up with uneven lips. I definitely recommend bringing your patients back for a 2-week follow-up so that swelling and bruising can subside and you can truly assess the patient's results. Here I am applying ComfortTox Lip Kit. This has arnica and essential oils in it to speed up healing. I'm also explaining to my patient where she has bruising and swelling so she knows what expectations to have when her lips heal. And I'm also educating her on any signs and symptoms of complications.